The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and we're glad that you've joined us today. We're going to talk about a very interesting subject today, that being social support. And joining me is Dr. David DeRose from the Lifestyle Center of America. He is a specialist in internal medicine and preventive medicine. That means he wants to prevent you from getting any disease or stopping or reversing that disease. And he's also a researcher. Welcome, Dr. DeRose.
It's great to be with you, Don.
Today we're going to talk about social support. This is kind of not a hard science. So many times we talk with physicians and they're talking about objective facts, this, that, and the other. But we call this a softer science. Why do we call it that?
Well, I mean, a lot of people use those terms because they say, yeah, this isn't, getting in the laboratory and giving people a drug or measuring something. But what we're doing, Don, in the research literature, we're looking at what happens to people when they are connected with other people, when they get social support, when individuals are strengthening one another, and it's really contributing to hard scientific endpoints. In other words, we're showing that social support can raise HDL levels, the good cholesterol. We're showing that social support can decrease depression and the risk of depression. And these things are measurable. So what we're doing is we look at this area that seems kind of soft and kind of fuzzy and kind of, social science, not hard science, as some of the medical researchers like to say. What many people are saying is social science is hard science, and we can come up with hard endpoints when we come to social support.
So you're going to have big problems if you don't have social support. Are there different dimensions to this whole idea of social support?
I mean, there's clearly many dimensions. A lot of times people want to look at social connectedness. That means how many contacts you have. If you look objectively at someone, you can say, well, they're involved with maybe their church or their workplace.
4-H,
they have this 4-H, right, this number of friends.
Yeah.
That's a way of looking at social connectedness. But the research is suggesting, Don, that it's not just how many connections you have, it's your perception of whether you are supported, whether you have individuals around you that are building you up.
Mm-hmm. So, like, for instance, let's talk about someone who makes a significant decision that seems to alienate the rest of his family. Can he have social support and make it through that kind of a situation?
Well, you can have social support from other avenues beside your family.
Mm-hmm.
I think one of the great illustrations of social support is in the Scriptures themselves. When I think of Jesus in his very closing hours of his ministry, in the Gospel of John, the curtain is pulled back on some of Jesus' final moments there as he's approaching his crucifixion. And in John chapter 13, to me there's a very telling incident that happens here. Jesus actually, instead of getting out there on the streets of Jerusalem and trying to heal as many people as possible in those closing hours, he's alone there in the upper room with his disciples, and he's washing their feet. And in John 13, it makes this very telling statement. After Jesus has done this, he says to them, know ye that I have done to you? In verse 12, he says, in verse 13, he says, Master and Lord you call me, and ye say, well, for so I am. If I then, your Lord and Master, have washed your feet, you also ought to wash one another's feet. Jesus isn't there just setting up some ordinance. I believe he's making a powerful statement about social support in the church. Mm-hmm. And Don, the research today suggests when you look at heart disease and you look at blood pressure problems, you look at thyroid problems, you look at a whole host of things, social support makes an impact. And Jesus, when he spent that time in the upper room, instead of healing on the streets of Jerusalem, in the long run, the message he's given to the church is that we need this social support. We need to press together. And I really think, Don, what Jesus did in John 13 has healed more people in history through his building up of the concept of social support in the church than he could have healed if he was physically out there on the streets of Jerusalem healing hundreds of people.
In other words, his last night, not going out with a bang doing that, but setting in motion something that could really be healing over a long amount of time.
That's right. Powerful ministry.
Now, you work at the Lifestyle Center of America. You do research there. You work with people a lot. They come to your program and then they leave. And what do you say to them? How do they go back with their new changes they've made and have social support or connectedness?
Well, you know, as people go through our program, it's a 19-day intensive program for many diseases, people dealing with diabetes or heart disease or high blood pressure, a host of other diseases. And I like to think of social support starting before people even come to our program.
Mm-hmm.
I mean, a classic example was someone I recently visited with in his home environment. Ray Little Turtle is a Native American of the Lumbee tribe in North Carolina, and Ray never would have come to the Lifestyle Center of America were it not for social support before he came.
I think we have some footage of Ray, don't we?
We do. Ray's going to give us some insights.
Let's see how it goes.
Well, my wife had been on me for a long time about diabetes. Being a Native person, it's very prevalent among Indians for diabetes. And I knew I had diabetes several years before coming here. And I just really didn't address it. I really accepted the fact I had it and did nothing for a cure or anything for it. So I came because I was asked. We were at an Indian Unity Conference, and a guy, Fred Rogers from Seventh-day Adventist Church, happened to come to that Indian gathering, and I was speaking about diabetes. And after he finished, he told me about Lifestyle Center. And I said, maybe this might be a chance that I can do a little better. So I came really to explore the ideal and to appease my wife, because she saw the importance of having diabetes under control.
What Ray is saying is that he would never have gotten the help he needed were it not for social contacts. It was his wife encouraging him to get serious about his diabetes. It was Fred Rogers, a Seventh-day Adventist pastor who's a Native American himself, who told him about what we were doing at the Lifestyle Center of America. And it doesn't mean he had to come to our center. I mean, Fred's referring people to other resources there in the southeastern United States. But the exciting thing is social support reinvigorated Ray's health. I just saw him recently, and he's a new man. I was rubbing shoulders with him at a Native American conference, and there were people coming up to him and saying, yeah, I mean, you know, Ray, you look great. I mean, you're doing so much better. It's just exciting to see the impact of what social contacts can do in helping us address needed areas in our lives.
So when they get to, for instance, your center, I know in our programs, when we do health programs and whatnot, and I've been involved in quite a few as well, we try and help them learn how to be socially involved or have this connectedness. Do you do that at the Lifestyle Center as well?
Don, actually, this is interesting. You're talking about the church. We're talking about the Lifestyle Center of America in Oklahoma. And a lot of people, they say, well, you know, I don't live in Wichita, Kansas, or in Oklahoma. How can I get the benefits of this? What's going on here? What you're doing in the church level, what other churches are doing when they have health programs, what we're doing at the Lifestyle Center of America is saying, look, the conventional medical system doesn't address these social needs. You go into the doctor's office, you go to the hospital, but there's no social connectedness that's built in.
Right.
And Christ himself, in instituting the church and saying in Hebrews that what we need to be doing as we see the end of times approaching is encouraging one another. He's saying this is a vital part of our whole person health.
Don't forsake assembling together.
That's right. And so we can take in all kinds of good material, whether it's on 3ABN, whether it's in video programs, whether it's reading. But if we're not getting that social connectedness, we're missing something. So, you know, coming back to your question, well, what happens at the Lifestyle Center of America? Well, people, when they come there, they become socially connected because it's designed as a program where people are going through an experience together.
So they stay in touch with each other?
They do. That's after the program. But I want to focus on what happens during the program.
Okay.
Pauline Berry and her husband Jerry came through our program, and they're going to join us by way of a video clip right now, and
Okay.
Pauline shares with us exactly what happened to her in this social support dimension.
All right.
Each person here is treated as an individual. The staff, the doctors get to know everyone individually. And the nice thing is, all the people here, we get to know each other. And we're such a help to each other. And some of the people that came discouraged, well, the other people just rally around them and help them. And I think it's just really great. It's really, really nice in that aspect.
That's great. I mean, it sounds like they're emotively involved with one another. They feel for one another. Does that continue after the program?
It actually does. You know, many guests tell us, I think of Ella. She's a African-American woman from New York. She came through our program and she talked about the marvelous social support that continued with her whole group. I mean, they were sending around a letter, I guess you call it a round robin or something, where, you know, each one would share what they were doing, and they'd continue to support each other and encourage each other. Mm-hmm. And the interesting thing is, this dimension of social support, when you're touched, Don, when someone is touched by a program that makes a difference in their life, when they come for a 19-day program and they lose 10 or 15 pounds, I mean, the average patient that goes through our program loses about 4 to 5% of their body weight.
Mm-hmm. In 19 days.
In 19 days. And so for someone who's been trying to lose weight, they've hit a plateau, I mean, they are excited. They are energized by that. But it doesn't just touch them. Part of what helped them to be successful was the social support. Mm-hmm. Let me give you just an example that Ella shared with us some time ago. She said one of the things that made a difference in the program is when she was struggling in those 19 days, mm-hmm. trying to follow a lifestyle-based program, controlling her diet better, learning how to eat better, learning how to cook foods better, exercising. When she was struggling, what do you think she said was the thing that helped her?
Social support, people doing it with her.
That's exactly right. They would encourage her. They say, Ella, you can do it. And this dimension we often forget. When you go to the doctor's office, when you see a physician, who is there encouraging you?
Really, not, maybe the nurses,
yeah,
but maybe not.
Maybe not. They tell you to do something. Time and time again, Don, people come to our center and they say, the doctor said, you know, lose weight, change your diet. And then when they go back the next time, what happens?
They don't remember what they said, or maybe they have to start all over again.
Or they didn't have the resources to do it, mm-hmm. because they don't have a supportive environment. And so this is why I get excited when I talk with someone like you, or when I visit at your church and see how you're working at a church level to enhance this dimension of social support, to have this mutual encouragement. And so that social support in the disease process, it's important at the beginning because it helps people get attention, like we saw Ray Little Turtle mm-hmm. sharing. It's important while you're addressing problems, like Pauline Berry was sharing. And then it's important when people go home because it has derivative benefits.
Do you have a clip of Ella or someone that talks about what happens when they went home?
Actually, I've got another clip, and this is from Gardenia Montalvo. She came through our program a while back. She actually felt she was at death's door. Now, not mm-hmm. everyone comes to us that bad off. Her family really thought that their mother, the kids, thought their mother, Gardenia, was really
not long in this life.
Not long in this life. In fact, after Gardenia went through, I think it was the first program with us. She's come back for a few more. But the daughter sent a letter to all the staff saying, thank you for giving us back our mother.
Wow.
And Gardenia shares in this clip just what happened as a result of her coming to the Lifestyle Center of America.
Well, let's go to Gardenia.
My family is absolutely ecstatic because they love me very much, and they were sure I was going to, pretty soon get into a very bad shape or pretty soon pass away. So they were very worried about me, and they kept begging me to do something about it, and they are so happy. And everyone has been touched by my experience here. I brought my youngest daughter, and she's strictly vegan. She exercises daily. And my oldest daughter has my recipe book, and she has put her family on soy products. And everyone that I've prayed for that it would touch their lives, like my sister-in-law and my nephew and godson, they came through the program and their health has improved 1,000-fold. So I've been very blessed that way, because not only my health has improved, I have touched some people and their health has improved too.
That's just great. I mean, you know, coming back from death's door, talking about how she has these relationships with her family. We have our mother back, we're cooking together, and then she's reaching out to other people. I mean, this must be, is this gratifying?
Oh, it's exciting, Don. That's why we're there. I mean, that's why we've got a team of people that are dedicated to helping people in a concentrated way in a context of social support, where it's the staff, but not just the staff. It's the other people going through the same experience that makes such a difference. And it doesn't have to happen in Sulphur, Oklahoma at the Lifestyle Center of America. It can happen in your own church, in your own community. I mean, you know that with the CHIC program you do there in Wichita.
You know, there are some pitfalls sometimes to staying in touch with one another, you know, things that just mitigate against social support. We're going to go to a break right now, Doctor, but when we come back, we're going to continue talking about social support. How can you make sure you're getting adequate? How can you make sure that you're involved in the way you should be? Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. David DeRose. We're talking about social support. Doctor, can we get too much social support?
Can we get too much?
Yeah.
Well, we can give too much social support. One classic study is of caregivers of Alzheimer's patients. When these individuals are the exclusive caregivers, where they're not getting the relief that they need, they are giving too much, really. They're not getting time for the social support they need. Now, when I say social support, from a spiritual perspective, from a Christian perspective, I believe there's a merging of two lines of research literature that we have to talk about today.
What do you mean?
Well,
there's like church, and there's like, what do you mean, merging of the spiritual and the other?
You know, a lot of times in the research literature, we look at social support as being one thing, and then we look at something else that we call it religious well-being or religiosity. We use terms like this. But I see the spiritual and the social as being very similar. Let me illustrate this.
Okay.
In the religious domain, when we administer questionnaires to people, trying to assess the strength of their religious commitments, we often ask questions like, do you believe in a personal God? Do you feel you have a personal relationship with God? I mean, if you think about that for a minute, we're talking about social support, if you will, on a divine level. Now, some people say, well, that's not social, that's God's support. But really, it is, I believe, another dimension to this same area. And what did Jesus do? Yes, Jesus had social support. He had intimate friends and the disciples, or Mary and Martha and Lazarus. But what else did he do? Early in the morning, he was out there seeking his Father, getting that revitalization from communion with nature and communion with God. And so we need this balance in our lives. We need to be receiving as well as giving. If we're all giving, like those exclusive caregivers for Alzheimer's patients, measurable decreases in their immune system. We can only give so much.
So we have to be recharging our batteries. You know, in working in healthcare myself, I recognize that there were those that seemed to be pretty cynical. You know, they'd be jaded. They'd work with people all day, and they just didn't have anything to give. But the ones that did have the spiritual underpinnings, like you're talking about, seemed to be excited, more buoyant, and they could give
That's right.
even more.
And it's interesting, if you look at the literature talking about social support on a human level, and you look at the literature dealing with religious commitment, religious strength, fellowship with God, if you will, you look at those dimensions, and they have similar effects. Both the strengths in both of those areas helps to decrease blood pressure in stressful life situations, helps to decrease the risk of depression, which is an enormous problem in our society today. So it helps us to be able to give when we're willing to receive.
Now, let's talk real practically, Doctor. Okay, we're talking, what do you mean exactly by giving social support? I'm at home, I'm sitting there, I go, well, how do I do this? It sounds so great. I want my blood pressure to go down, not too low, but I want it to be, normal. I want these things to happen. What are you talking about when you say social support? What is it exactly?
Okay, to make it real practical, if someone's saying, how can I be part of a social support network?
Right.
First of all, look at the relationships you already have. Are you enhancing those relationships? I mean, how do your children relate to you? How do your parents relate to you? Are you only a consumer? Are you taking, or are you giving? That's the first question to ask. A second thing to ask is, can you facilitate social networks in your sphere of influence? One classic way of doing it is just being involved in your church. I mean, a lot of people today have a spectator mentality when it comes to worship. It's very easy in a big church to just kind of, sit back and, say, well, that sermon today was okay, but, maybe if I'd gone, across town, there would have been a better sermon.
Okay.
We get in this spectator mentality instead
the
of saying...
take model instead of the give.
Right.
So you're saying instead of doing that, you say, hey, how can I go out and visit someone maybe at the nursing home? Can I see who's shut in and hasn't had a visit? Can I make a loaf of bread? Can I invite someone to my house? Can I do this, do that? Can I watch your kids because it looks like you're, well, maybe you wouldn't say this, you're a little stressed out there, but I want to help you out, in a nice way. Is that what you mean?
All those are excellent examples, but it doesn't even have to take any extra time. You can walk into your church, or a church that you've never been to.
Right.
Okay? And you say, I want to start getting involved with the church. I haven't been going to church. I've looked at, religion as just something between God and myself, but I want to start fellowshipping with people. And instead of walking in with a focus on what am I going to get, look around the congregation, see if someone's sitting alone. At the end of the church service, or at the beginning, if you see someone who's just standing there, or who's walking out alone, make an effort to say hello.
I hope there are a lot of people listening, because this is a real big need, even in churches. I usually am almost stationary up front, because I'm up front as a pastor many weeks. And I'll see people that are sitting alone, and I'll see that other people don't even see them. It's like they have tunnel vision. And so, sometimes I'll say to someone sitting with me on the platform, hey, would you go mention to this person to go sit by that person? I try and facilitate that. But what you're saying is just go with this idea of service during the service.
That's right. And so it doesn't have to take you don't have to plan a meal for 37 people at your house. You can take little interest, just taking an interest in people, giving them a call on the phone. It can be simple things.
Let me switch, channels here, if you will, for a minute. I used to work all the time with mostly women. I was working in the nursing profession, and there are, of course, many men in the nursing profession too, but where I worked, it was mostly women, and then there was me. My wife was working as an architect with mostly men, and then there was her. But, I noticed something as I went through two different courses of study. I noticed that when I went through the nursing program, it was largely women there. And then I went through a theology program, a degree, and it was mostly male teachers there. I noticed that the support, it seemed at least to me, was greater in the nursing program than in the theology program. And I don't know. I'm just asking. Is there anything to this idea that a woman can give better social support than a man?
Well, Don, you may say two guys talking here. We may not want to own up to this, but it's true, actually.
Is that right?
Yeah, there's been some very interesting research through the years. I mean, one of the earliest examples I know of was in the Alameda County Health Study. This is just a monumental study as far as public health and preventive medicine. First studies were published like in 1970. It's an old study now. But they found, when they looked at the benefit of marriage, for example, You know, guys like to think they're doing their wives a favor when they marry them. but the Alameda County Health Study showed that the ones who really got the dramatic benefit from being married were men. This was the first study that I came across that raised my attention to the fact that the social support from a woman may be more valuable. Now, a more recent study, in the year 2000, I believe, from the University of California at San Francisco, I think I'm quoting this right, but anyway, it's one of the UC schools that did this research, took over 100 individuals, and they looked at what happens in a stressful situation. They were having people speak in front of an audience. Now, for some of us that do that frequently, that may not be that stressful. But for most people, this is one of the real high-stress activities that you can imagine. And when there were supportive people in the audience, the blood pressure response to stress was decreased. But here's the catch. If the supportive people were women, that blood pressure response was much less.
Wow.
Women had a greater stress-relieving effect than men did. And there's a lot of speculation as to why this is the case, but the research is pretty clear that women have some unique benefits as far as social support. Men have other strengths, and they have, you know, I'm not trying to give the message that men can't be socially supportive. But what the point is, Don, is that we've got to get serious about realizing that God has called together a body. I mean, this is why the church is not just an all-male social club or an all-women's church. God pulls together the genders because we have unique strengths as well as unique differences. And it's exciting to see what happens in this dynamic, whether it's in the church, whether it's at the Lifestyle Center of America, whether it's in a community group, the same dynamic can take place in all those settings.
That's great. And you know, I think that people today were probably pretty motivated to get involved. But I have one last question. We have about a minute and a half left. And Doctor, you know, in terms of giving social support, we've said, hey, we've got to be getting something spiritually to give that. What do you do day by day? What is your secret for giving social support? Where do you get, and how's that work for you?
I'll tell you, the thing that's vital to me, Don, is meeting with my Lord. To open His Word, to pray, to get counsel from Him, to get direction from Him and encouragement. That's what really inspires me, and that's what really gives me something to share. You know, many times, no matter what kind of background we have, no matter what kind of experience, in my personal case, sometimes I seem like I just don't have what it takes. But when I meet with the Lord, when He encourages me, He gives me something to share.
Amen. And, you know, that's really the key, isn't it? We've been talking with Dr. David DeRose. He's a physician at the Lifestyle Center of America in Sulphur, Oklahoma. And we've been talking about social support. It's been fascinating to hear what you've had to say. We hope that you, as you've been listening today, have had a new sense of what you can do to be involved socially, but most importantly, that you can have that connection with the giver of life, the master physician. Thanks for joining us today.